Hi everyone, welcome to BMC Global Live AL-HILAL Health World. I'm Gauri Priya with you. Right now I'm standing in AL-HILAL Multi-Speciality Medical Center, Salmabad. We are here today to meet our Dr. Rajani Ramachandran. She is a gynecologist who has 13 years of work experience and is currently working in this branch today. Hi doctor, how are you?
I'm good. How are you, Gauri?
I am fine, doctor. Doctor, due to our life conditions and lifestyles changing, most of us are facing many health issues and the health concerns are high. It's growing day by day.
Yeah.
And most of my friends are talking about their menstruation being irregular and all. So, is that a health condition? And they were also mentioning about PCOS. Could you please explain what PCOS is?
Yeah, very well said, Gauri. As you told me, like your friends are mentioning, in my daily practice, when I sit in the OPD, if I have around 25 patients in a day, most of the women who come in are, are suffering from irregular periods. Cyclical periods are not in the vogue nowadays. It's like most of them have irregular periods. And you might not be surprised to see some women not menstruating at all throughout the year. So it's like, when did you last have your periods? Maybe in a year, doctor. It seems so like, a normal thing for some people because their siblings have the same thing, their mom must have had the same thing. And one characteristic that you might see in the family is they're all overweight. You might have noticed that. And too much of hair growth on the chin, over the face, and too much of pimples over the face. These are very common characteristics of what you call as PCOS. Well, you abbreviated, it's an abbreviation. So what is the expanded form? I would just break it up a little more. It would be called Polycystic Ovarian Syndrome. So what is a syndrome? Syndrome in our technical term is a set of medical signs and symptoms, okay. And so what is this a syndrome of? Poly. What does poly mean? Poly means multiple or many. So, and cis I would say is rather a misnomer because cis earlier on when this disease was like found, even the disease has been removed and made it into a terminology called syndrome because disease something seems like an infection or something. So they just got it into the nomenclature of syndrome because it is an enigma. Believe me, Gauri, this is a disease with so much of cascades, hormonal imbalance. It presents to different doctors in different ways. Like your friend might just have overweight, but she may not think overweight is a big thing because everyone in her family are overweight. So she might have had some facial hair. Now when you're 18, 19 and 20, it's more of aesthetic, you want to look good. So what do you see? Too many acne, too many hair. So you are not thinking about pregnancy or normal cycles or anything. You're just thinking about how you look. So you go to the dermatologist asking, doctor, I have the skin problem. They get treated for years together without knowing really what the real problem is. So I started with something like, what is a cyst? So when you say a cyst to a normal lady, okay, I have a lady coming into this OPD carrying a scan finding of a picture of polycystic ovarian scan picture and tells me, doctor, I have cysts in my ovary. Is this something of a concern? So how is it that they're going to react? Like, how am I going to tell them? No, you don't have to panic. It doesn't mean that you have too many cysts or you're going to die of that. Cyst basically is like fluid-filled sacs, okay? Initially, when the doctors it was Steen and Leventhal, two gynecologists who really found this first, and that's why it's also called Steen-Leventhal syndrome. So when they started out, they saw on scans of many patients, they're seeing like string-like appearance of pearls. It's like a sack of pearls, okay, and fluid-filled follicles all around the ovaries, and the ovaries are a lot more bigger, but these cysts are very tiny, believe me, hardly 2 to 10 mm follicles, very tiny follicles. It's not like huge cysts like you have 10 centimeter, 20 cysts around. That will make your ovaries really bloated. That's not the way it is. It is like tiny cysts, follicles. And believe me, you have more eggs than normal women do, but the problem is they're immature eggs. None of them. So when they saw that bag of the ovaries converted into a sac of too many of fluid-filled follicles, they started calling it like too many, that is poly, and cystic is fluid-filled follicles, and a syndrome. So it is in the ovary. Okay, that is where it all starts.
Okay, doctor, what causes polycystic ovarian syndrome?
That's a good question, Gauri, because we really have to know what really starts it all. Well, genetic causes have been implicated for this. Well, there are many studies that have been done, like when you see monozygous twins, that is identical twins, if one of the twin has polycystic ovaries, there are very high chances the other twin gets it too. And also first degree relatives. If your mother or your sister, one of the sibling has it, your chances of getting polycystic ovarian syndrome is really high. So this clearly indicates there is a genetic predisposition in the disease, which is something that we cannot change. Another thing is environmental causes, especially the kind of lifestyle we lead. Suppose we are born into a family like, totally the kind of life we lead, like there are no parks anywhere, and you just, commute by transportation, that is a car, you like totally taken fully working every day, and you do not have any time for exercise, or you do not cook your own food, and you just buy, like what do you do? What is the kind of life?
Yeah, we usually just take our money and then we go to canteen and then we buy all the chocolates, chips and sandwiches.
So such kind of highly processed, refined carbohydrate, when it surges the blood sugars a lot, and then this itself is a cause for PCOS. And together with it, tied in very closely, is obesity. Obesity and environmental factors go together. And also it has been seen, like suppose you are like obese from the beginning of life, like before you attain puberty, like kind of you see 8-year-old, 9-year-old kids walking around really with that kind of fat, that's not really good. So pre-pubertal obesity is an incriminating factor for PCOS. Also it has been seen children who attain menarche before the age of 10, that is by 8 or 10, as they grow into adults, they are more chances of getting PCOS. Also in utero, if your mother has been exposed, like your mother was exposed to drugs that, like androgens, so your fetal exposure also increases the risk of PCOS. And certain drugs, like some women have seizure disorder and they take valproic acid, so this also increases the risk for polycystic ovarian syndrome.
So doctor, how do we know when one has PCOS? So how is the person presented?
Yeah, that's a very good question, Gauri. Well, before I answer that question, like how one presents, I just want to tell you a little about what polycystic ovarian syndrome is all about. It is a multifactorial disease. The whole problem is usually every woman has a certain amount of androgen levels in the body. That is, androgen means it's a male sex hormone. We all have it in a certain level, but in condition like polycystic ovarian syndrome, which affects around 5 to 15% of women, in such group of women, they have more testosterone in the body than normal. And why does this happen? Where is this androgen or male sex hormone synthesized? In the ovaries. The seat of synthesis is in the ovaries. They start producing a lot of sex hormones, male sex hormones, not the female. So when this happens, the ovary becomes the seat of production of excessive androgen. And when this happens, it gives a negative feedback to the brain to stop ovulation. So it hits at the brain level to the ovaries to stop ovulating. See, the whole thing about having your cycles is you're forming an egg mid-cycle every cycle, right? Mid-cycle you ovulate. But when there is an excess of androgen in our body, it hits into the main thing, that is the seat of the ovary, and ovulation is inhibited. Once ovulation is inhibited, what happens is you do not have periods. One, either you do not have periods all through the year, amenorrheic, they do not have periods, either that is that, otherwise you have less than 9 periods in a year. So they have, like, some people have every 2 months, some people have every 6 months or 3 months. And when they do bleed, okay, they bleed excessively because there is unopposed estrogen in the body, and also because there is too much of male testosterone in our body surging so much in the blood, we have male pattern of. So you can just, now I will answer your question, what are the clinical features the patient is going to present with. So because the polycystic ovarian syndrome has hit on the target, that is ovulation, you do not get your periods regularly. You got that point? Why you do not menstruate? Because excess of male hormone inhibits ovulation, and so you do not get your periods properly, right? So that rings a bell that you do not have periods regularly, you menstruate irregularly, or you do not have your periods. So you know how a patient would present, right? Next is, this excessive androgen circulating in the body is not going to keep quiet. You will have kind of male features. What are the male features that you see? One, you have too many acne over your skin, okay? Facial acne, too many. Second, you have like male pattern of baldness, especially frontal balding. Hair loss will be too much, and also male pattern of distribution of hair. Okay, so you will have kind of beard, chin area between your breasts, hair growth. This is something that is very common. So these are the 3 patterns of signs of hyperandrogenism. And then finally, what does a doctor do? Now you present it to the OPD with, like, what did I say, irregular periods, or you're not having periods, or you have too much of facial hair, then you have like too much of acne, then you have like hair loss or frontal balding. That is something that patients present with. And the third thing that is there is obesity. Most of the patients, 75% of the patients are on the overweight side. So these are the kind of people, and they have even velvety patches, thickening of skin around the nape of the neck. That is a sign of acanthosis nigricans, which comes in insulin resistance. So these are the features that a patient comes to you with.
Okay. So doctor, does this PCOS have any long-term implications?
Yeah, Gauri, it does. It does really have a lot of, it's not just, it's, I told you, it is an endocrinological disorder, a metabolic disorder. It hits at every target organ. So it's not just, you know, to the localized to the ovary. It has a lot of effects on the body. Well, to begin with, I told you about obesity. Most of the women who present with polycystic ovaries are obese, and they present with a metabolic syndrome, wherein if you check their blood pressures, it's usually on the higher side, and you run their lipid profile, that is the blood for fasting cholesterol and triglycerides, will be way too high. And also they'll have a lot of obesity over the central obesity, which is called the truncal obesity. That's one thing. And you might have heard like something about insulin resistance. Most of these women have a lot of insulin resistance. So what happens is, when you eat all this kind of food, high carb diet, what happens is, in polycystic ovaries, the uptake of sugar from the blood is really less. The insulin resistance keeps building. So what happens is, because of the increased sugar in the blood, it keeps tapping on the pancreas to keep producing more insulin. And so it is a vicious cycle which keeps going on, and this causes impaired glucose metabolism, and this finally leads to diabetes.
Okay.
You might have heard about that.
Yes.
So
I've also heard my friends telling me that it could lead to cancer. Is that
very
possible?
true, very true. Well, the mechanism cascade that would really lead to cancer is, I told you, you do not have regular periods, right? So why does it happen? You have unopposed estrogen in the body, you do not have progesterone. See, a lot of follicles are recruited, come into the game, and one of them wins to become the dominant follicle, releases the egg the mid-cycle, and 2 weeks later you get your periods when the progesterone withdraws. So it's a game between estrogen and progesterone, and 2 gonadotropins called FSH and LH. It's all between the brain and the ovaries. But then what happens is, when PCOS comes in, It's a game between androgen, insulin resistance, and the whole game is like really a spoil sport. So what happens is you have like too much of estrogen, just one kind of hormone acting on the endometrium, that is the lining of the uterus, and this kind of keeps thickening and thickening. See, the first half of the periods is a proliferative phase, and the second half, you must have heard, is a secretory phase. So in the estrogenic phase, you have proliferation, it becomes thick, the endometrium really becomes thick, and it's stabilized in the second half, but that stabilization never occurs. So what happens, it keeps proliferating, and that's called endometrial hyperplasia, and when it's not supported, it breaks down, and then you get a breakthrough bleeding. That's why women bleed whenever they want to. It's like, it just happens, you cannot predict when it happens, you know. So it's not a regularized this one. So when this goes on and on, you know, you fall prey to what is known as endometrial cancer. Okay. So the only way to get rid of this is reducing weight. Okay. And another thing I told you about how it can cause metabolic syndrome, diabetes, endometrial cancer. Because you're not ovulating and not forming egg, the chances of having a baby, that is having infertility, is very rampant in these women. Okay, it's one of the leading causes of infertility in women, PCOS. And also we have like other problems, like when they're fat, they're not able to breathe well when they go to sleep. So there are like obstructive sleep apnea because of thick pad of fat around the neck. So that causes very bad sleep pattern, and when you're like obese, walking around with diabetes, and you're not having kids, and many multitude of problem, aesthetic problem of having hair and all that, you get increasingly depressed.
So being overweight can cause this. So maybe these days due to COVID, we are always sitting in front of gadgets. So I think the patients for PCOS must have increased right now.
Yeah, of course. They're like 15-year-olds walking in with 7 kg gain in weight. You can see them walking through the OPD, and I know they have PCOS. Okay. And moms really don't know that this is the cause for their regular periods. They're kind of surprised. So these are the long-term implications. And also, apart from the depression and anxiety, it can cause cardiovascular problems. Cardiovascular problems because you have dyslipidemia. Your lipids are always going bonkers. Your sugars are not in the normal range. You have obstructive sleep apnea, not sleeping well. So all this leads to cardiovascular abnormalities. Okay. So these are in just a short what PCOS can really do to you.
Okay, doctor.